Hey everybody, my name is Carl Bonnet. I am the founder and medical director for Klarisana. Thanks so much for checking out Klarisana. So, I want to talk briefly about the concept of psychedelic medicine. A lot of folks who are interested in getting treatment with ketamine have some questions, maybe concerns, whatnot about that term. I realize it could be a little bit of a loaded term and somewhat scary for some people. But really, what we're trying to do in the ketamine space is to leverage a non ordinary state of consciousness to show you your life, show you your perspective from a different angle, right? So, a lot of this revolves around the idea of a paradigm, a mental paradigm. So people who've been through a variety of psychological stressors, whatever the case may be, tend to have a paradigm which is counterproductive. The way they see the world, they see the way they see themselves in the world, and whatnot. And that's what we are trying to change. So really, what we're just trying to do is use a mind-altering substance in a controlled setting to change one's mind. Now, the thing is, it's very hard to put this into words is exactly how it works because that's kind of the idea, right? I mean, if you could describe it easily, then one would argue that talk therapy and other things would have worked already, right? So what we're trying to do is use a non-ordinary state of consciousness to change the way you see things. So one analogy that I'll give you is let's take a look at this butterfly. All right, so this butterfly, let's say that this is your paradigm. This is the way you see the world as a result of the way you were raised, as a result of experiences you may have had. You look at this butterfly, and this is it. This is what your experience. So now, if we use talk therapy, if we use psychotropic medications and whatnot, we can change the butterfly, right? We can change the color of the butterfly, so we can turn it green, or if we try a different medication, we can turn it blue. So all these things are metaphors to just explain that really you're still seeing this butterfly, you're still seeing this paradigm, but things are changed just a little bit. Now, let's say we give you ketamine, we give you a mind altering medication, we do it in a controlled setting like we do at Clarisana. Now, all of a sudden, when you look at this butterfly, let's take a little bit closer look. Now, you can see the snout, you can see the eyes, you can see that it looks like there's a dog on the wing of this butterfly. So, in fact, this is the California dog faced butterfly. So now that we've done that, well, now that we've changed things, some of you may have seen it before. Many of you probably didn't necessarily see that the dog head in that butterfly wing. So now let's go back to the original picture, right? Is there any way now that you can't see the butterfly? Right. I mean, when you look at it now, it's completely different. It's a whole different experience. So that is what we're trying to do with psychedelic medicine. We're trying to change the way you see things. Another way to think of this, we'll give an analogy of a radio. So let's say we lock you in a room with a radio and we tune it to a station that you absolutely hate, right? Some sort of music that you really, really don't like. So again, if I give you an antidepressant medication or some other, traditional medications, or maybe just some basic talk therapy or whatnot, what we do is really just turn the volume down on that station, but you still hear it. So it's maybe not as loud, but you're still just like, oh man, I cannot stand that music. So, and then the problem is then if a life stressor comes along, all of a sudden the volume can be turned right back up on that, and then you're right back where you were at the beginning, and that can be super counterproductive and very frustrating. Now, imagine when we use ketamine or any kind of substance that alters the mind in a controlled setting, then what we do is like changing the channel, right? So if we change the channel on that radio to a station that you like, to a music that you like, then you become volume insensitive. All right, I mean, you turn up the volume, you like it, it's a song you like, it's a band you like. Sure, the analogy kind of falls apart if you turn up too loud because your eardrums will hurt. But you get my point is that what we're trying to do is change your paradigm, change the way you see things. So that is basically what we're doing with ketamine. So I invite you to check out our website, learn more about what we're doing, and look at some of our other videos to learn more about how leveraging a non-ordinary state of consciousness can be beneficial to change your mental paradigm and advance you on your route of healing.